everyone, I'm Alexis and welcome back to Anesthesia Insights. If you're thinking about exploring a career in the anesthesia field, but thought that being a nurse anesthetist or a CRNA was your only option, then you're in the right place. I'm a registered nurse with a background in ICU that decided to go the Anesthesiologist Assistant route, and today I'll be sharing the key differences between AAs and CRNAs, breaking down the educational requirements to give you insights on what path might be best for you and your goals. Let's jump right in. First, let's talk about the differences between anesthesiologist assistants and certified registered nurse anesthetists or CRNAs. Both roles are crucial in delivering anesthesia care, but there are some key distinctions. AAs are specifically trained to work within an anesthesia care team under the direct supervision of an anesthesiologist. This collaborative model ensures that patients receive comprehensive care with the expertise of both the anesthesiologist and the AA. So if you're someone who enjoys working as part of a team and values the support of a supervising anesthesiologist, the AA role might be ideal for you. CRNAs often have more autonomy and in many states can practice independently without the need for supervision by an anesthesiologist. However, in some states, CRNAs still work as part of the anesthesia care team, similar to AAs. If you want to have the ability to work in all 50 states and some outlying islands, if you want to work autonomously, the CRNA role might be ideal for you. Now let's talk about the educational pathway to becoming an anesthesiologist assistant. To start, you'll need a bachelor's degree, preferably in a science-related field like biology, chemistry, or maybe even healthcare. Most AA programs require certain prerequisites, such as coursework in biology, chemistry, physics, and sometimes anatomy and physiology, which I'll dive into in a different video. Once you have your bachelor's degree and meet the prerequisites, the next step is to apply to a master's program in anesthesia. This typically lasts around 28 months. These programs are rigorous and include both classroom instruction and hands-on clinical training. You'll learn about anesthesia techniques, pharmacology, patient monitoring, and more. After completing your master's degree, you must pass the certification exam for anesthesiologist assistants. This is administered by the National Commission for Certification of Anesthesiologist Assistants, or NCCAA. I know it's a mouthful. Once certified, you'll need to participate in continuing education to maintain your certification and stay current with advances in anesthesia care. Now let's compare that with the educational pathway for Certified Registered Nurse Anesthetists, or CRNAs. To become a CRNA, you first must need to obtain a Bachelor of Science in Nursing, or a BSN, and then you can gain licensure as a registered nurse. Typically, CRNAs are required to spend at least 1 year working in an intensive care unit and ICU to build their critical care experiences before applying to a graduate level nurse anesthesia program. Many programs want at least 2 years, and some programs might not accept specialized ICUs like NICU, a neonatal ICU. These programs for CRNAs are highly specialized and typically take 3 years to complete. They build on your nursing experience and provide advanced training in anesthesia techniques. This can be pharmacology and patient care. CRNAs also complete rigorous clinical rotations similar to AAs, but they often have the added benefit of being able to practice independently in many states. Why might an RN choose the AA path over becoming a CRNA? One of the key benefits is the close alignment with the anesthesiologists. AAs are trained to work under the supervision of an anesthesiologist, which can be a great fit for RNs who value collaboration and team-based care, just like myself. I have spoken extensively with some RNs, and they do not wish to go to the ICU to train for up to 2 years to apply to CRNA school. Other RNs are OR nurses that have already worked alongside anesthesiologist assistants, and they find the career path to be rewarding. This, in my humble opinion, is really fantastic because they already have this experience with sterile field, working alongside anesthesiologists, surgeons, and the rest of the team. And they already have access to acquiring shadow hours and letters of recommendation for AA school. Experience as any type of RN, especially in patient care and critical thinking, will be incredibly valuable as you transition into the AA role. You're already familiar with monitoring patients, managing medications, responding to emergencies, all of which are essential skills for an AA. Plus, the structured and supervised environment of the AA role is normal to you and that means you're always working alongside an anesthesiologist, providing a support system so that you continue to develop your expertise. I hope this video has given you a clear understanding of the pathways to become an anesthesiologist assistant or the differences between an AA and a CRNA. If you're looking to advance your career, either path can offer exciting opportunities depending on your interests and career goals. If you have any questions or want to learn more, drop a comment below and I'd love to help. Also, don't forget to subscribe. And remember, even when the journey gets tough, be like a pearl, made from grit but full of grace. See you in the next video.